Hello, my name is Kaylee Baylor and I am currently a health science major here at BCU, but I have plans beyond that. I soon hope to be joining the highly competitive nursing program here at BCU. Since the age of 12, I've always dreamed of becoming a nurse. I plan on specializing in neonatal intensive care and pediatrics. I even have personal experience watching a neonate grow into a beautiful young child. Here's Aiden. Aiden was born 3 pounds, 11 ounces, and 2.5 months premature. This is Aiden here in the NICU. And here he is today, all thanks to the wonderful NICU nurses and healthcare providers here in the U.S. Shouldn't every neonate be given a fair chance at life? This video clip shows you a typical U.S. neonate in a typical NICU. So how can the U.S. improve neonatal care in developing countries? Well, let me start off by answering the question, what is neonatal care? Neonatal care is performed in the neonatal intensive care unit, which focuses on taking care of ill and premature infants, oftentimes referred to as neonates. A premature infant can be classified as any baby born between 37 weeks of gestation, otherwise known as a due date. When a fetus is not carried full term when it leaves the womb, the infant requires intensive care and treatments in order to compensate for time lost in the womb. So why should the U.S. help? Studies have proven that the care of premature infants is significantly greater in developed countries than that of the developing countries. The top 10 countries with the highest mortality rates are developing countries. These countries lack education, technology, and common practice. So why can we help? The United States has some of the best nursing and medical schools in the world, giving us the best healthcare providers in the world. It has been proven that the United States spends more than any other country on healthcare. With that comes more technology and a better education for all. There is a clear and evident inequality amongst countries today in terms of neonatal care. If we begin to settle this inequality, we may be able to improve survival rates amongst neonates overall.
We are moving into our new addition. It's 25 beds in the neonatal ICU addition that make us a total of 100 bed in ICU, and we are moving a total of 15 patients today. We are very excited because we have now added 17 private rooms to the neonatal ICU, and these families will be able to stay with their babies 24/7 and participate in the care without having to go back and forth from the waiting room or Ronald McDonald House or even their home to take care of their babies.
And we are moving our current waiting room to the new family house. Our new family house will offer more welcoming accommodations. We have new washers and dryers for all the families. We have a full-size kitchen where they can prepare their meals in there. With our new expansion today, we will be having quieter spaces for our patients to move into with the private rooms and better accommodations. The noise level will drop dramatically with that, and the patients will have better outcomes with this new environment.
As you can see, here in the U.S. we have a great amount of technology and healthcare providers.
She's eating, but she's not passing stool. Not passing stool yet? Is she passing gas? Yes. Okay, so that's fine. She's passing gas, she's eating. Her pain on a scale of 0 to 10, 0 is no pain, 10 is a lot of pain. What is that?
As you can see here, the doctor is doing everything she can to help, but developing countries lack the amount of resources and technology to adequately care for their patients, and that's what you see in a typical NICU in a developing country. Here you see 2 neonates located in Ghana, Africa. They are not in incubators because most developing countries lack this technology. Here you see a global world map. The darker colors represent the highest mortality rates and the lightest represent the lowest. As you can see, the darkest colors come from developing countries and the lightest come from developed. As you can see, the United States has one of the lowest colors on the world map. So how exactly can the United States help developing countries improve their infant mortality rates? Well, it can be broken down into 3 simple steps. Step 1. Educate. The U.S. should send healthcare providers to educate those in developing countries because most developing countries do not have a formal healthcare training program, causing mortality rates to skyrocket. Step 2. Establish a common practice. For example, educating developing countries on an adequate birth weight and gestational age of a preterm infant who has a potential of a successful treatment. Step 3. Donate. Donating pieces of neonatal technology to developing countries to use in their NICU would substantially increase their mortality rates. The United States has an abundance of NICU supplies to give away. If you're interested in this topic, here's how to help. Join the UNICEF Club here at VCU, or if you are interested in nursing, join Nursing Students Without Borders. I believe everyone has the potential to make their dreams and visions come true, because here at VCU, we make it real. Thank you for listening.